Achilles tendon injuries start to affect men typically in their 30s, but can affect men and women of all ages. The Achilles tendon starts to get brittle and less elastic as we reach our 30s, and so you're more likely to have tears or injuries to it at that time. The Achilles tendon attaches the calf muscle to your heel bone. It helps to push off or plantar flex the foot, and it's frequently injured from explosive type push off, so jumping, running, or coming down from jumping. Most people, when they rupture their Achilles tendon, say they landed and felt like somebody kicked them in the back of the ankle, or they got hit in the back of the ankle with something, as they feel that tendon snap and pull apart. Sometimes people will feel the tendon kind of snap and roll up or pull up into the top of the calf. Achilles tendon rupture tends to be a very distinct type feeling, and people usually recognize they've had a significant injury at the time. Sometimes people are still able to walk after the injury, and they're usually surprised by that. Sometimes people can still plantar flex or push their foot down because there are other muscles and tendons that do that. Even if you can plantar flex or push your foot down, there's still a possibility that you've completely torn the Achilles tendon. After an Achilles tendon rupture or injury, somebody needs to be evaluated by an orthopedic surgeon. There's a certain test called a Thompson test where we evaluate the Achilles tendon. We squeeze the calf muscle and we see if the foot and ankle moves up and down correctly. That can help determine whether the Achilles tendon is completely torn, partially torn, or other. Typically, if you feel along the Achilles tendon, you can feel a gap if there's a significant tear in the tendon. And sometimes we have to do an MRI to get a better picture of what actually is going on at the tendon, and is there a complete tear or a partial tear, and that can help determine whether surgery is required.